My name's Natasha. I'm a podiatrist with the East Sussex Healthcare Trust. We are basically experts in lower limb pathologies. So we know all about the anatomy, we know about vascular supply, we know about neurological problems, and it's all to help with promoting foot health.
There's lots of different ways because people come into it now through the apprentice route. You could be a podiatry assistant and you could go to an apprentice route that way. We have staff who are first contact practitioners. We have staff who are advanced practitioners as well. We have staff working the at-risk pathway, so that's all the wound care. So it's not just diabetes, it covers all wound care that might come into the service.
If you want something that's rewarding and it's career rewarding as well, okay, I would be looking at this. There's a lot more to it than you think.
We're helping the NHS 10-year long-term plan, which is to reduce the risk of cardiovascular disease. And we play a really important role in that because we do assessments like what we call a Doppler assessment, where we test your blood flow coming down to the foot. We can pick up conditions early, such as irregular heartbeats. And by picking up those conditions early, you can then reduce the risk of heart attacks and strokes. So you've got to be caring, you've got to go, well actually we need to do more investigations into this. But you've also got to have the passion to want to help people.
We get some of the best people in the world over here, which is great because you get such a great knowledge base and you learn off the best. But there's always an avenue and always something to do. In the NHS, you're always on top of it.
I can honestly say that working in podiatry is the most caring and supportive team I've ever had the privilege of getting to know. The management are genuinely caring towards their staff and they will bend over backwards to help you. I've never worked with such a lovely group of people, and that's one of the reasons why working in podiatry is such a fabulous thing.
As a general podiatrist, there's lots of different avenues to move into. Okay? So you can go down the diabetic wound care path, you can go down the surgery path, you can go down the MSK path. So there's lots of little avenues, but for myself, looking at the injection therapy and extending that for us as a podiatry unit, that's key for us at the moment.
Look at the Trust website, look at the Royal College of Podiatry's website, see what's out there, see what's available, see what your career pathway could be as well. There's so many more opportunities out there now than when I started. When I started you were a generalist podiatrist and you might be lucky if you got into anything else. Now there's a whole range of things going right up into senior management. Our head of the directorate is a podiatrist.